the biopsy, the test, whatever it is, it's cancer. You are now, as my sister would say, you are a statistic. Would you walk us through what should happen next from an insurance perspective?
They should call us and say, I just heard I've got a cancer diagnosis. I'm nervous and I'm scared. I know that you guys support and have different ways. And we do that through our cancer support program.
People see the insurance company on their phone and their first reaction is fear. My doctor says I need this treatment, but insurance denied it.
The first denial is really because the insurance company didn't get the right level of information. A lot of it is solved by just making sure the provider understands what information is needed.
What's your advice for someone looking to kick cancer's ass?
Put everybody around you that you can. Make sure that you're leaning in on whoever your insurance company is. Call them, tell them you need support. And you know what? Don't back down.
Hi, this is Joelle Kaufman, and this is Kicking Cancer's Ass. I'm so excited to have our next guest. Steve Cain runs UnitedHealthcare California. Yep, he's the CEO of UnitedHealthcare California, which in many places would be its own country.
So, right. Really big.
It's really big. California has a lot of people. And I had the pleasure of hearing Steve speak at Cancer at the Crossroads. And he spoke about a number of innovations that under his leadership, UnitedHealthcare California has piloted or deployed. I just want to get into it. So Steve, welcome to Kicking Cancer's Ass.
Yeah, let's do it. Joelle, great seeing you. And I just have to say, it was awesome that we connected at that event that you're referencing there where we met. I think it was Cancer at a Crossroads, which was a really cool event. And I was happy to be part of it and really explain kind of what a payer's role is in the journey of patients and members going through cancer. And I thought your enthusiasm when we connected after my panel was awesome. And I could tell you're obviously very devoted to this. And you seem like a super fun person. And I'm super glad we connected. So this is awesome.
Me too. And, my simple backstory is, we've been dealing with cancer in my family for 43 years, and we've had many different insurers. And given the kind of care we have been privileged to receive, we are very thankful for health insurance. And we've had our own share of challenges. And I think it's one of the least understood with the third payer, with the hospital, with the doctor, with the patient. I think most of us are just generally confused.
Sure.
So,
hey, well, listen, for the first off, healthcare is confusing.
Yeah.
And, it can be scary and it can be really hard to navigate at times. And, we're committed. We're not perfect, nor is the entire payer universe perfect. But I think, most of us are dedicated to trying to improve that process and that navigation and supporting members and making care more affordable, making it easier to access, easier to understand. I mean, so we're all in this together, whether you're on my side of the fence, if you're on the provider side of the fence, the regulatory side of the fence, the pharmacy side of the fence, we all are in this together. And the more that we come together, I think, we only make it easier for, we're talking about cancer patients today, and that's, an incredibly vulnerable population. And, it's really incumbent upon us to figure it out, right? We have to. We just have to.
I love that you feel that way. And I agree with you. And I think it is going to be a collaboration. So I want to talk about a moment that feels very isolating, right?
Yeah.
The moment that a physician I've had people who it's been a electronic health record alert, but you find out the biopsy, the test, whatever it is, it's cancer. You are now, as my sister would say, you are a statistic. You have cancer.
Right.
Now, would you walk us through what should happen next from an insurance perspective? Because I don't think people realize that their insurance company is a resource here.
Yeah, it's first off, you're so right. Like, you have cancer are three terrifying words. And they're not only terrifying for the individual hearing them, they're terrifying for their entire family and support system. We all know that. There's not one person that's listening to this podcast who doesn't have a family or friend who is diagnosed with cancer or themselves got the horrible news of having cancer. But we know more than ever, you know this, Joelle, because you're doing this every day, is that there's been so many awesome advancements, whether it be on the oncology side, on the treatment side, getting to it quicker, the navigation process. So I think it's getting better. There's, to earlier comments, there's room to improve. But I think, those are three scary words, and we take those words very seriously. And so from our perspective, from a payer perspective, and yes, we are talking about United, and there's certain things that we'll talk about today on programs that we have in place to help navigate those with cancer. But, let's face it, our competitors also have programs in place. And so, I feel confident that, the major insurers out there all have some version of what we have. So we're collectively in this together. So whether or not a listener is a UnitedHealthcare member or a member of another plan, some of this back and forth you and I will have will apply regardless, right? And so when I think about when you hear those three words, the first kind of thing I think of is, well, this shouldn't become confusing, and it shouldn't be about paperwork. It should be about how do we support the member. And, one of the things that you and I kind of touched base on was, we have developed some programs over the years, and we keep enhancing those programs. One of them is our cancer support program for members who get those three horrible words. And it really is taking kind of a holistic approach to making sure that that member gets that information. Where do they go? And where they should immediately go is calling us. They should call us and say, I've just heard I've got a cancer diagnosis. I'm nervous and I'm scared. And I know that you guys support and have different ways. And we do that through our cancer support program. And it's not just hey, you're going to call in and talk to somebody different. It's really a multidisciplinary approach. So it's, yes, you'll have one navigator that's assigned to you through your entire journey. That is your person. And we have over 100 registered nurses that have oncology experience. And so those nurses work directly with those members who get that news. And they also tie in other resources. So whether it be on the provider side, it could be social workers, it could be resources that are available in the community that you live. They have the ability to kind of stretch into those tentacles and figure out, hey, how else can we support you? Because there's the benefit side. We all have different benefits. Your employer chooses those benefits, and those benefits have different ranges. You could have high deductible, low deductible, high copays, low copays, different pharmacy copays. But it shouldn't be your job when you get that diagnosis to figure out every spot that I have benefits. So that's why we created the cancer support program, is to allow that navigator to take that burden off you and take that burden off your family. And we also bring in, if that same member, I'll give an example real quick. My dad got diagnosed with cancer, and my sister happened to live near my dad. And we had my sister just be a big part of the whole thing, working with what would be equivalent to a cancer support navigator. And so making sure you bring people in. Cancer's a journey. This. You got to have a support system. And, figuring it out on your own is really difficult. And we know that when you're trying to figure it out on your own, things slip through the cracks, right?
Absolutely.
I didn't hear it right. I mean, who the heck can sit there and comprehend that level of information when you figure out you have cancer? You need someone there to help you. And so that cancer support program is 360 degrees around the member through their entire journey. And so that's what I first think of is call us, get into the program, and allow us to help support your journey through that. And, look, these providers, especially in California, some of the bigger health systems here have really great resources as well, right? And so the cancer support navigator can actually help you to say, using examples to say, hey, I'm at John Muir, or I'm at UCSF or Sutter or Stanford. They have programs in place too to support members, and making sure you kind of hook that all together and who's doing what, and who can help navigate what pieces of this, and bring that all together and organizing it, I think is also helpful. So there's resources for us, cancer support program, and then there's 100%, most of these big providers have resources that they can also apply for the member.
So what's really interesting that you say that, Steve, is I've talked to, 1,000 cancer patients and survivors, and I have literally found one who got her diagnosis, and the next call she got was from a cancer nurse, an oncology nurse navigator.
Yeah.
It was actually Pittsburgh, UPMC. Everybody else didn't know to ask, didn't know where to call. And and I actually wrote a book called Crushing the Cancer Curveball so that people who didn't know what to do could say, here's the book, which isn't as good as an oncology nurse navigator, but it's a little bit more, here's the sequence that things happen. And so you can be, and why I do this podcast, but if they don't know to call, what are the triggers for an oncology nurse navigator to reach out? Are there any? Do they use email, my chart, phone call, a letter? Like, what do you do?
Yeah, that's a good question. You're right. It's not perfect. And sometimes even whether it's on the provider side or the member side, even outside of cancers, there's a host of resources that are available to us through our plan that you don't even know about, right?
Right.
Unless you dive in, you take the time to really understand your benefit package, which, let's just face it, some people just don't dive in to the degree that they should. One of the things that we do is, we kind of look at look at the analytics and do some like predictive modeling based on real-time claim data that's coming in. So based on, oh, wait a second here, there was a screening test for cancer. Oh, there was a diagnostic test that was for, cancer, some level of cancer, let's say breast cancer. Wait a second, there's pharmacy data coming in. We have the ability to take that, it kind of risk stratifies it and says, oh, okay, this may deem an outreach. This is going to trigger an outreach. And that outreach can be done in a number of different ways. It can be done either directly to the member via an email, if we have that information, a phone call. It's not perfect though, Joelle. Because let's face
Sure.
it, who the heck picks up their phone anymore? And it's just the reality. And the other thing that we are continuing to try to do is build that trust bridge. Because let's face it, payers still have a ways to go to really build that trust bridge. And so when members are like, oh, my insurance company is calling, what does that mean? How helpful are they really going to be? But the fact is that payers like United, we are so invested in folks who are going through cancer. We spend a lot of time and resources and commitment always thinking about how we can do it better. And so that's what I would say is we use analytics, predictive modeling, looking at the various claims data coming through that triggers outreach.
Yeah, I wasn't with
Not
United when.
perfect, but
No,
it's
I'm not. No
it
no
helps.
one should be looking for perfect. No, nothing's perfect.
Right.
If people see this podcast and know, just pick up the phone and call. Like, that's your fastest way. Pick up the phone, call the number on your insurance card, and say, "I just got diagnosed with cancer. Do you have a navigator to help me?" And you're off to the races. But if you're not that proactive, if you're in shock, I remember my carrier sent a postcard. And the only thing that was amusing, and the postcard was very nice, it was, big, and you couldn't miss it in the mail. It was probably 2 to 3 months into my journey by the time I
Right.
got it. And, they were
Right.
trying, imperfect,
Right.
but actually just, tipping of the hat, I decided to proactively do things to reduce the risk of lymphedema, which, for those of you who don't know, when you've had lymph nodes removed as part of your surgery, you can get swelling if your lymph system can't drain properly, and that can be permanent. So there are lymphedema physical therapists, lymphedema sleeves. This is not something you find on Yelp.
Right. Right.
Right?
Right.
So, and you can make yourself crazy calling half the immediate world because it's actually a kind of a very little niche. You know who knows? An oncology nurse navigator.
Right. That's who knows.
They
That's
know.
that's exactly right. That's who knows. And you said something earlier too that triggered something, a comment I wanted to make is there is this phenomenon now, right, that's happening not only for cancer diagnosis, but in general, where we're all have some kind of electronic medical record. You reference my chart.
Mhm.
And I just know it for a fact in my own family, we all do it. You go get a test and you're playing doctor. And you're like, well, what does this mean? Oh my gosh, I haven't even talked to my doctor. And then maybe you cut and paste it, now throw it into Copilot or to ChatGPT. And then it starts snowballing. And you're like, oh my gosh, what's wrong? What do I have? I'm in trouble. And, I think there's more work to be done to be more thoughtful about how that happens and how
Mhm.
that data gets submitted. It's difficult, right? Because it's all synchronized. It's a little bit of AI in there where it's just like, boom, it's there. And I think around things like cancer diagnosis, we need to put some sensitivity, around that, I think.
You're right.
So because I know friends recently who have gone through this where, you know, let's say you get you go get a test, a mammogram or something, and you read it, and it's a Friday afternoon, and all of a sudden there's no one to talk to, and you're not going to talk to your doctor until the following week. Those are hard days. Those
They
are really hard
are.
days.
They are. And I often tell people, like, don't torture yourself like that. What people don't realize
Yeah.
is for the solid tumors. So I'm not talking about lymphoma or leukemia, but for the solid tumors, a couple days, a week or two actually isn't material. Even for people who I had triple negative, hyper aggressive strain of breast cancer, even for people like me,
Right.
it's like, a couple weeks, it's okay. We're not going from where you are to metastatic to untreatable in a couple weeks. So, you have this panic. I have to do something. And I can appreciate you don't want the oncology nurse navigator to call before that person has talked with their doctor. It's almost like we need a flag, which
Right.
is, patient has been advised.
Right.
Like,
Right. Right. Yeah.
now
That's a good way
release
to
it.
put it.
Now release it into their My Chart so they can see it. Now let the payer know patient has been advised, and the machination can then begin.
Right. That's
Um,
exactly right.
yeah, and it is scary. I mean, it's scary, particularly if you never have heard it. I will tell you, Steve, my reaction, I was diagnosed the day before I was supposed to have a prophylactic bilateral mastectomy because I have a strong family history and genetic.
Right.
And so she called me and I said, "You have to be effing kidding me." Like, that was
Right.
literally my
Right.
response.
Are you kidding? Tomorrow I'm
Right.
doing
Like,
this.
nice punked. You punked me. And she's like, "No." I said, "Can we have surgery tomorrow anyway?" She says, "No." Like, ugh, I like organize my life around this. But that's what cancer does. It disrupts your life.
It
Now,
does.
you mentioned, people see the insurance company on their phone and their first reaction is fear. And they're afraid because the story, and you've heard it, my doctor says I need this treatment, but insurance denied it, or I'm waiting 3 weeks for prior authorization while my cancer is growing. So, like, you're the insider. What's happening? And what can a patient do to speed this up or challenge? What's best practice here?
Yeah, it's a good question, right? And that's frustrating part of insurance at times, right? Is navigating that. And again, I'll just lean back. I'm going to answer your question, but that's where the cancer support program and that navigator can help in these areas too. But let's answer your direct question here. So, a couple things. You know, remember, a member always has the right to appeal. A member always has the right, if they're in a denial situation, let's say they're not using a cancer support program navigator, and they get a denial, and they've got people helping them, maybe family supporters, is you can always call and say, I want to appeal this, and there's an appeal process. And when you call your insurance company, they can walk you through what that looks like, and that will require the physician, if it gets into that sticky situation of appeals, is, the provider, a lot of the times, I would say, is getting the right information from the provider to the insurance company. Now again, that whole process, not fun,
Mhm.
but, and this isn't, there's not putting blame on the providers, but what we see statistically is a lot of denials. The first denial is really because the insurance company didn't get the right level of information. And so a lot of it is solved by just making sure the provider understands what information is needed to grant the approval or to get into the next step of the prior authorization. So that's number one. I think the other thing that we try to do with cancer patients is say, well, wait a second, how can we support the provider in this process? So we created a platform called the Cancer Guidance Program. And this is now for providers, and it's tied to whether it be having to get radiation treatment or getting approval for oncology drugs. It's an integrated platform that sits in a EMR, a lot of cases. So it's right there in their workflow, and their ability to say, okay, And it's all NCCN guidelines. So this is not UHC's guidelines. These are all NCCN guidelines. The key there is that if the doctor uses that platform and they follow the pathways, and we're talking about hours, not days and weeks, we're talking about hours where these prior authorizations get approved. And what we're seeing with the doctors who use this platform, the guidance program platform, is that we're seeing, because it's quicker, because it's faster, we're seeing less ER admits, seeing less in hospitalizations, less admits into the hospital. And we're seeing better adherence to the right drugs, not duplicating drugs, all those safety measures. And so it's not only about what the member does and what we do, but it's also how can we put a platform in front of the provider to make those next steps after you get diagnosed with cancer, which is going into now treatment, that approval process gets sped up. We have the approval rates on some of these programs are really, really high, which is great to see. Like, we obviously do audit to check to see how our customers are satisfied, our providers are satisfied, and in both cases, really high marks from an NPS perspective, so a net promoter score, way to measure all that stuff, and just pure satisfaction. So the key, though, Joelle, is educating the provider community like that's available. And this isn't trying to say, oh, we know more than the doctor. We're just saying, hey, here's guidelines and pathways that if you follow, you get approval like that. So that's how I would answer that question.
Well, and I think there's a really important second point, which came up in what you said, but for the patient, the most common reason you get a letter that says it's denied is insufficient information.
Right.
And the patient doesn't have the information to provide you in the appeal. But the first call might actually be to the provider saying, hey, this got denied for insufficient information. Can you please review, talk to my carrier, my payer, and give them the information they need?
Right.
Because, and if they have it's the cancer guidance system.
It's the cancer guidance program.
The cancer guidance program can make that even easier. There's also peer-to-peer where doctors are talking with medical directors at the insurance company.
Yep.
There's a number of steps. So I think one of the interesting things, I'll throw this out to you, is perhaps approved or denied is too black and white. Maybe there's pending more information, right? There's this, it's approved, we need more information, or it's actually denied.
That is, I think you're right. I think there is, in that whole prior authorization world, there is nuance, and there is what you're discussing, which is, this part of it is approved, this part is not. So it's not a blanket, kind of where you're getting to. And, I would just say this to your listeners: prior authorization gets a lot of talk these days, but, from number one, there's not as much that gets applied, prior authorization applies to, in theory, when you look at the, tens of thousands of medical codes are out there. But I would just say, if you look at the data is very clear. There is such a disparity in cost of care, quality of care. Even when you look at, a screenshot of just here, I live in the East Bay. And if you take a screenshot of just the providers that are in the East Bay, there is so varying outcomes. So infection rates, readmissions, sometimes same exact procedure can be 3 times more at one hospital versus another. And so this whole disparity in care, not only from a quality perspective, but a cost perspective, is real. This is not fake news. This is real news. And that you can, the data is 100% accurate. And so in some cases, you want us putting prior authorization on certain things to make sure that the patient is getting the best appropriate care, that it's, there's efficacy, there's safety involved, and cost. I mean, we can't ignore cost when it comes to cancer treatment. Cancer treatment can be very expensive, and depending on each individual has different benefits. We try to go do the best possible thing we can, which is strike the best possible deal on the charges that hospitals charge back to us that we have to put into premiums. So this is all just pass through from them to us, and then we've got to put that into a premium. So, we do our very best to drive value-based care, incentivize the doctors to treat appropriately, to have the right outcomes. And so prior authorization gets a lot of headlines, but at the same time, I can tell you without it, there would be different outcomes and care would probably be more expensive.
So I also want to put a point on, because I don't think people realize that the benefit, how much your copays are, your max out of pocket, your deductible, and your prior authorizations is actually part of the plan design with the employer, right?
Correct.
And, so there's not a lot you can do, but you can talk to your employer about the design.
Right.
And there's certain things, like it's hard to read a benefits plan. I mean, I've got a master's degree and I still find them mind boggling, but I can, and we even built a calculator for it. I say to people, look at what your deductible is and your max out of pocket per year and lifetime, because that's giving you a sense of your exposure
Right.
financially,
Right.
right? And it is what it is. It's the plan you signed up for. It's the plan you were offered. And if you know where I'm going to be in trouble if I get to this threshold, there's actually a lot of programs through the hospitals, through nonprofits, to help take some of the bite out of that.
For sure.
And so, again, being able to advocate
And
is
there's more
important.
transparency tools, right? I mean, we've advanced transparency quite a bit where members now have real idea of what the real cost is for the entire episode of care. And so there is no more guessing. And so, years ago, we really tried to drive, making all of us better consumers of healthcare. I mean, I don't know about you, but if I go to Best Buy, I'll sit there and I'll do 14 weeks of homework to figure out which TV I want to buy. But we do none of that when it comes to the care that we need, which is a really interesting disconnect. And so, we're trying to drive more transparency, not just around cost, which is important, but around quality. So all that data now is out there in some version, and we're now tying different products to it where members now have it sitting right at their fingertips. And so I think it's only going to get more and more transparent around, cost and quality, allowing us to become better consumers of healthcare and really decide, hey, Mr. Provider, you just told me I needed to get an MRI. I just pulled it up in 5 seconds. Where you're sending me, it's costing me $2,000, but there's a place right across the street from me that's $500. Why can't I go there?
Right. Right.
Like, that's when you start changing the game, right? And that has nothing to do, that's not about cancer necessarily, but it does tie in because if you've got a high deductible, these diagnostic tests that we're talking about, and they're sending you somewhere that's 3 times as much as it is to go to an outpatient facility, that impacts your wallet.
Of course it does. So let's talk about diagnostic screening, because I heard you talk about something pretty amazing about eliminating copays for certain diagnostic cancer screening in California. Could you talk about that and what
Yeah.
inspired that and what the impact has been?
Yeah. So United is really proud of this. It wasn't launched that long ago. So the basic concept is, and then we'll kind of back into it, but the basic concept is, hey, your cancer screenings are going to be zero copay. So it'll be no copay, so nothing out of your pocket. And then that first diagnostic screening, if warranted, will also be $0 copay. So let's back into the why. The why is there is such a range in social economics and social determinants of health. And, and so some people are very in tune with their healthcare. Some people have the funds to do whatever care they need and get whatever care they need. But the matter of the fact is the data is really clear. When you make it $0 copays, people actually go get the test. And so now there's not a financial barrier to get the test. So if you go in and you get your annual, mammogram, $0 copay. If they see something and they need a diagnostic test, $0 copay. And why that matters is that same member, let's just say they're working mom, 2 kids, they're making ends meet, barely making minimum wage. They might just decide, I can't do that right now. And so if they decide to do that and delay care, then you know this
I
better
do.
than anybody. It's like if you delay care, the outcomes only get worse, and that
Right.
the data is very clear on that. And so let's not delay care. Let's remove some financial barriers, not all of them, and let's at least remove those first couple where the clock is ticking, and we need to get that member, if they're diagnosed with cancer, into treatment, into a cancer support program, Navigator, and get the flywheel going on getting their treatment, and we just know the outcomes are better. So that's the whole purpose is really just looking at the big picture here, and by removing the burden of a copay, the outcomes for the member are just so much better.
So when you do this, because you were just talking a moment ago about this different tests are very different priced, is the member told you have no copay, here are the places you can go? Or does the member go wherever they want?
Yeah, I mean, very plan dependent, right? And we don't want to get into all that, but you could have an HMO, or you got a primary care doctor, or they're navigating you and you got to go where they tell you to go. You could have a PPO, so ultimately you could decide where to go. Um, and so there's a different answer depending on what your plan is. You
Okay,
could
fair
be on
enough.
a individual insurance, but bottom line is, in most cases, your doctor is going to recommend where to go. And that's where I kind of back into like, hey, but if we become more consumers of care, you can say, well, wait a second, hold on, why are you sending me here? So, but that's how I probably would answer that. But
Okay.
it's, these are things that, we're continuing to press on, like we've made insulin as an example, $0. Does not cost any out of pocket to get insulin. Why? Because we know diabetics who are taking insulin are healthier,
Mhm.
and their out of pocket is less, and the out of pocket for the employer and the plan is less. So a compliant diabetic costs 3 times less than a non-compliant diabetic. So make the insulin zero.
Exactly. Exactly. So a few minutes ago, you talked about how you use data that comes in through claims and AI to start to risk stratify. And I think you're using AI and advanced analytics to do some care coordination between people. For someone who is trying to coordinate what feels like a bunch of people and specialists they never wanted, they never heard of, oncology, surgeons, radiation oncologists, nutritionists, therapists, what have you. How's this technology going to make the patient's life better? Like, what does coordinated care look like in the future using all of this technology?
Yeah, I mean, AI honestly should make it easier just to understand your benefits, understand how data is going between, to your point, between the people you just mentioned, between your doctor, medical doctor, your oncologist, your, possibly social workers, other folks. Like AI, that's like ripe for AI, just to be creating those instant digital connections and making sure that kind of administration layer of cancer navigation is just more efficient. And it's a place also for resources and decision tree and, decision support, and that all is just ripe for AI. And I think it's only going to get better. From my perspective, as I think about AI in healthcare, we're in the infantile stages still. I mean, let's face it. I mean, ChatGPT wasn't even around 2 years ago. And look what we're all doing with that kind of technology now. And so I would say to your members, over the next 10 years, I think what AI is going to do is just take out a lot of inefficiencies. So you think about all of the things that have to happen to administer claims and answer phones and all the advocacy work and all the operational stuff that goes into healthcare. AI will try to tackle a lot of that. So I think AI ultimately, whether it be through your phones or digital assets, there's a lot of back office AI stuff that's happening to do all that coordinating. But I think you still have to have someone, a person there supporting you. So I don't think AI is going to do that anytime soon. I still think you need that navigator to help pull that all together for you. I think that first couple inches deep in the administration and information is all there for AI, but you still need a human person there that's got your back.
Oh, absolutely. Absolutely. And, They tell you have cancer and you need to see an oncologist, and you sit and say, I don't have an oncologist. Of course you don't have an oncologist if you've never had cancer. It it's a whole and how AI can help with all the coordination and scheduling. Um, I think it can be really helpful.
Yeah, I
So
agree.
so you said your mission is to fundamentally change the member experience and remove cost from the system, which is ambitious, right? So what's your guidance to someone who's fighting cancer and feels like they're fighting their insurance company? How do they change this relationship?
Yeah, I would say first, like we talked about it in the beginning, right? Get that support mechanism around you. Cancer's a journey that takes a lot of people to support you. Make sure you lean in whether it be you or a family member, and your family member can do this too. Like, there's a family member can call on your behalf and say, hey, I need some information, and we can help that family member help the patient. So that's first of all. And number two, I think it's just continuing to lean in on um, making it simpler and easier, right? It's too hard, right? And so I think we've made great strides and making it easier. Things like, what we talked about today with the cancer support program, the cancer guidance program. We're even launching a pilot. You heard me maybe mention this when I was on the panel. It's called the Early Detection Center. And so when those members that, need that extra little hand holding because maybe it's like a pretty severe diagnosis. I'm not suggesting by any stretch of the imagination that there's a difference between how we would help someone between different stages, but there is an urgency to when like, oh boy, like this is really, really bad and we need to grab you right now and start helping you navigate. And so using AI and other things so that there's no delay. And so we're piloting this early detection center. So boom, I got the diagnosis and it's not good. And so how do we quickly get that member in? So that's one thing that, that's just an example of ways that we're trying to ideate on this. And then, I would say I know that sometimes insurance companies get a bad rap, but, but I think just, we talked about, remember, we're in the whole healthcare dollar. If you use healthcare as a dollar, we're 10 cents of it. That's the math. So when you think about all the incredible high costs, whether it be on the hospital side, hospitals, if you look
Drugs.
at the trend, hospitals have gone up 286% since 2000. The provider side, the physician side, the pharmacy side, is a real concern. I mean, every day a different $3 million drug is being administered, life-saving drugs, but how you pay for all of this is not an easy solution. And so, we do a lot for the members that we serve. I'll give you one just quick tie-in. Maybe you'll follow this or not, but we have spent in California, we've spent $130 million since 2000 on affordable housing. And just 2 weeks ago, I was at an affordable housing event where I spoke, hard hat event, 90 units, getting moms off the street, living in hotels and other places. And it all connects because those same people get cancer. Those same people get the diagnosis. They get those three scary words. And so if we can get people off the streets into housing, put a roof over their head, we know roof over your head equals better health. And then just take that same example and that member gets cancer. Gets cancer when they're living in a hotel or a street versus living in a home with a roof over their head where they have community resources available. And so that's the stuff that kind of gets lost. But those are the kinds of things we're committed to is, giving back to and understanding social determinants of health and, food insecurities, housing insecurities, closing gaps of care, curating networks, putting tools in front of members, driving transparency. So again, we said it in the beginning, not perfect, but we have a real commitment to the communities we serve.
That's amazing. And it is so helpful because having a home base and having neighbors is just part of how we get through this. So,
Exactly.
um, you're welcome to not want to answer this. I am curious how you think about enrollment in clinical trials for your members.
Yeah, I think clinical trials are important. We support clinical trials. I think like anything else, like what we've kind of talked about today is, we are going to obviously make sure that the clinical trials are safe, that we're not putting a member in harm's way, that we believe in that, have an understanding of the data. United does not, arbitrarily just deny all clinical trials, that we support clinical trials on a regular basis. And we'll continue to do that. But we are always going to make sure that we're doing what's right for the member from the safety perspective, and that we understand the data and the science.
Okay, that's a fair approach. All right, this is the lightning round. I'm going to give you a line. You give the first thing that comes up in your mind.
Got it.
All right. Complete the sentence. The biggest mistake cancer patients make with their insurance is?
Not reaching out to us early enough.
What's your advice for someone looking to kick cancer's ass?
Put everybody around you that you can, your family, your friends. Make sure that you're leaning in on whoever your insurance company is. Call them, tell them you need support. And you know what? Don't back down. Get answers. And I would say also the same thing with your provider. Really lean into your provider and make sure that they are also supporting you.
I feel like I want to do a negotiation class, because that's part of what I've done professionally, a negotiation class for cancer patients. Feel like, here's how you ask for what you need relentlessly.
Relentlessly. I'm telling you, that's a great word. You have to be relentless. You do. You just do.
Yeah, I've said, other than perhaps a cancer nurse navigator, the only person who's the quarterback, the only person who knows everything that's happening is actually the patient and whoever their immediate family is. You're the quarterback. And, that means you got to tell people. And sometimes you tell people things that are good. Like, I told my oncologist I would like to go see my son play in his first collegiate baseball games. I know I have chemo every week. How do we do this? And we came up with a way to do it.
Love that.
It's awesome. I know I have people who had a wedding. My sister, she was diagnosed 3 months before her wedding. And survived it and has had 2 kids and is amazing. But in that moment, do we delay the wedding? What do we do? And the actual answer was, with her team, they timed the chemotherapy that she was between protocols for the wedding.
That's a great example. That you've got life, life still moves, and you've got to be able to move life along with getting through cancer treatment. And I think that's a great example. We too know all the, the high level stages, right? There's like, hey, make sure you're getting screened, to diagnosis, to living with cancer, to survivorship, to end of life. And so we have a responsibility through that entire continuum. So totally agree with you.
And the more, as a patient or a patient support person, the more you communicate, the more you share what you want, the better the system, the payers, the providers are able to help you possibly get as much of what you want. So I think your message, how to kick someone's ass, advocate relentlessly, is kind of the answer.
I'm there.
All right. If someone's treatment gets denied, what's the first thing they should do tomorrow morning?
Call their insurance company. If they're, let's say it's a United member and you have a Navigator, call your Navigator. Get their advice first, because a lot of times they'll do the calling for you, meaning, hey, got it, get the understanding what's happening, and then they'll call your provider on your behalf, right? And try to take you out of the middle. To your point about being relentless, if you're not feeling great about it, and let's say you don't have a Navigator, call the provider and say, why is this getting denied? And get a full understanding. And to your point, just keep using it. Be relentless until you get the information that you need. Because, oftentimes it's missing information that's causing the denial, and it's just clearing up why the heck there's that gap in misinformation.
Right. All right. What's one benefit or resource that most UnitedHealthcare members don't know they actually have access to?
Well, you know what I'm going to say.
Of course, but say it anyway.
I got to say it, the cancer support program. And, you've kind of like, even when we met in Palo Alto, the one thing that's been a takeaway for me is is trying to understand just how are we making sure that we're marketing this to our providers? Because one thing for sure is like the provider is going to be the first person, right? Right. And so if we can make sure our providers are aware the best that we can, that these programs are available, they can say, hey, Joelle, you're a UnitedHealthcare member. They've got a great cancer support program. And here's what you do. Like, it's just another way to capture the member.
And I think it's important there for people to realize it can be a both and. UnitedHealthcare has a great cancer support program, and your healthcare provider may also have a great cancer support program, and it's okay to use
Yes,
both. They will probably have some different expertise to help you.
exactly. Yeah, that you're spot on. They absolutely do. I mean, I can't think of one around here that doesn't have some level of support. So it's just marrying the two together.
Exactly. All right. If you could change one thing about how cancer patients and their families interact with insurance companies, what would it be?
That's a great question. I would say, a little bit of it is just back to that thought we just had, which is making sure they're just aware of the resources that are available. I mean, there's the cancer support program, but there's other things that are out there too that they just don't realize unless they dive in. And I think the other thing that I think about is big picture, and maybe AI will help with some of this, is just continue to make that connection and build those pipes between the insurance company and providers.
Excellent.
Because the more streamlined we are with data and aligned on that around things we talked about today, we just make the journey easier. It's when there's a gap between the provider and the payer that there's confusion and there's anxiety and there's misdirection. And I think the more alignment we can get and kind of break down those traditional barriers between providers and payers is only going to have the impact on the member, right, to make it easier for them to navigate care.
Steve, thank you for what you are committed to in making screening and diagnostics more available to more people, in helping people in that awful moment where they feel like the earth stopped turning and maybe they got turned upside down and shook
Right.
with cancer nurse navigators. I think the cancer management process you're doing with the doctors,
Yeah, cancer
fantastic.
guidance program. Yep.
Cancer guidance program where you're making it easier for things to get authorized and to know what data. I mean, these really make a difference to people going through cancer. And, I don't know if people are going to thank their insurance company. I know that I look at the treatment I got and that's like, my insurance company did right by me. Like,
That's good.
they did.
That's good. Well, look, it's a pleasure being on here with you. And this is an awesome conversation, such an important topic. And I would just note that, we, UnitedHealthcare, we are here for members in their journey through cancer. And that's a commitment that we will continue to not only make, but enhance.
Outstanding. Well, thank you so much for being part of Kicking Cancer's Ass.
Thanks. Have a great holiday.